Mm. Darren, how are you doing? Hi, live with Chanel. How are you? Hi, Nurse Parchi, Adelicia. Thank you for tuning in. RN to CEO, welcome. Hola, how are you doing? I'm just kind of giving a quick, you know, check in with my people here. You guys are at work? It has been a busy week. A very, very busy week. Hi, Dal Queen. How are you doing? Yeah, the work never ends, Deron says. I tell you. Yeah, I'm trying to finish my notes and everything before Thanksgiving. Hi, Moaz on Umar. Hi. Welcome. Yeah. Dal Queen says, I am good. How are you? I'm doing okay. Thank you. Just kind of trying to wind down for the week, even though it's midweek. Yeah. So it's not that bad. Feels like a Sunday, I guess, because tomorrow is Thanksgiving is tomorrow is Thanksgiving. Yeah. It just kind of feels like the weekend right now, but what's on the menu tomorrow, Deron says? Well, we're gonna get some chicken season tonight, and then we're gonna hang out with a few friends tomorrow. So we'll be probably doing probably some fish, jerk chicken, and pasta, potato salad, beans. I love beans. Chief Shaman, you haven't been to Jamaica yet. You must put on here jerk chicken. Yeah, the beans thing don't really work out for me. But thank you for tuning in, Chief Shaman. Where are you from? Yes, it's more of a Friendsgiving tomorrow, Deron. What you cooking up tomorrow, Deron? And I probably do some puff fried dumpling. Yes, probably do some fried dumpling as well. Beans land. Why do black people do so much dope? Death Valley. Okay. Thank you for tuning in, Mr. Valley or Mrs. Valley. Yeah. But that's what is going to be on the menu for tomorrow. So I'm excited about that because we always tend to meet up with a few friends and just hang out, and it's more of a big day. Chief Shaman says that's really good. A really good question. Um, yeah. Nikki did my turkey today. Tomorrow. Oh, you already done cook up a turkey. Okay, nice party. Nice. Um, Chief Shaman, why come they do that? Deron Speak says, I'm in charge of breakfast. I leave the big cooking up wife and the rest for family. Hi, Kama. How are you doing? Hello. Deron says, if you make me moderator, I can help you keep the chat. Of course, I need one of those, Deron. I definitely need one of those. I'm not so sure. That's how God made me, Evelyn, thank you so much. Do you live in Jamaica? Yeli. No, I'm overseas right now. Thank you. Chief Shaman says, okay. Life with Chanel. Yes, Zeron is the boss. Yeah. So, yeah, man, the breakfast. Okay, that makes sense. Craig Corrigan, how are you? I'm doing fine, thanks, Craig. How are you doing? Bertrude says your glasses look so slay. Thank you. They're actually sunglasses, and I always put my lens in, you know, the frame so that way I kind of get a classy look to it. But thanks much. Um, Chief Shaman says, all hail, all powerful Deron. Deron, just stop my name and follow instructions. Okay, kick their camber. Is it safe to visit Jamaica as a tourist? I've been there learning patois for 6 months and I'm thinking about visiting, but I'm not sure. Yes, it's good to visit there. Everywhere you go, you know, you have a little bit of a crime and violence there, but majority of them is like related to gang as well. So as long as you visit and you know where you're going to be going and spending time with, you know, the right people, then you should be fine. A lot of tourists tend to come there and they have a wonderful experience despite, you know, everything else. But yeah, it's a really nice place to visit. And yes, you learn the patois and try speak it. Yeah, them still gonna know say you're a tourist though. Linda says, you know, 3-5. Hi Linda, thank you so much for tuning in. Aaron, just click on Darren's name and it will give you option for standard moderator. Okay, cool. You see this thing here? Darren. All right. Okay, cool. All right, there you go, boss Darren. Thank you so much. And where is that other person that I wanted to? And this one. Put add as moderator standard. All right, so I went ahead and selected 2 persons. Seeing that I know how to do it now. Thank you, RN to CEO. Really appreciate that. All right. Yeah, man. Fix up the chat there, the chat room they're on. All right. Deron taught me. So Deron says RN to CEO. Yes, Deron has RN to CEO knows a lot about them stuff here, it seems. Thank you. He can place them in timeout. Nice, good. All right. So Lily Aqua, yeah, I'm very pale. I've been listening to dancehall and reggae for a while, and I thought I should give learning patois a chance. Love from Armenia. Okay, nice. You'll enjoy it there. All right, they'll know I'm a tourist right away. Yeah, once you have a little extra color, yeah, man, they'll pick up and know that you're a tourist, and especially if you're speaking the language, yeah, man. Raquel Young says, what was your first nursing job when you started here? Is it med-surg? What were the challenges you faced? So here in the US, I came in as an emergency room nurse, but my first nursing job was on a telefloor in Jamaica. Yeah. Some of the challenges I face, well, there are a lot of challenges you'll face when you're a new nurse in Jamaica, because most of the time it's related to, like, you know, resources and staffing. But when you just start out as a new nurse in Jamaica, there are challenges there, yes. But I guess because, you know, from your undergraduate program, when you're in nursing school, you're exposed to a lot of things because, as I said, there's a lot of short staff supplies. So pretty much you're assisting the nurses in the hospitals. A great deal, because a lot of them, you know, so for example, you're a student nurse, you're getting skills with, you know, doing your IVs, your catheterization, your dressing. So by the time you finish, you have certain confidence with that. So yes, there are going to be challenges, but it's not going to be that bad. When I got here, it was more of the EMR, using the EMR. That was the biggest challenge, because nursing everywhere is basically the same, you know. And then, you know, understanding how, you know, we do things here in America, even though the training is the same in terms of, you know, textbook wise, but in terms of resources, it's more available here in the US. So you might find out that you might have a bit of a challenge, adjusting to certain machines and all. So that's all. All right. Are you a nurse, Raquel? Okay. Yeah, but that's one of the biggest challenge as a new nurse. But as I say, it's more of like cultural issues when you get here, understanding the language, how they do certain things. That's one of the biggest challenge here. And yeah, so thank you to everyone who have tuned in so far on the live here. Okay, what year are you in, Raquel? That's area of nursing. And please remember to double tap on the screen to give it a like. Did you always know you wanted to be an NP? I know that I wanted to do my master's. I wanted to actually do public health nursing in Jamaica and midwifery. Not necessarily nurse practitioner. Yeah. I wanted to be in the community setting and helping out on that level. But then after a while, the nurse practitioner role in terms of being there, advocating a little bit more for my patients and getting certain things done. Yeah, it was later on I decided that, probably the nurse practitioner role is what I want to do, because I can still do a little bit of a hands-on and still be seeing the patients in acute or, the outpatient setting. So yeah. Raquel said, just graduated. I'm in subacute facility and hoping to land in hospital soon. Okay. Are you in Jamaica or the US, Raquel? Yeah. So, that's about it. So the nurse practitioner role just kind of, New York. Okay. Okay. Darren says, I love my public health rotation during nursing school in Jamaica. I did it in Denhamtown. Okay, interesting. Where did we do? I think I did mine in Manchester. Yeah, I did mine in Manchester. We went into the communities and all, community health. But the public health was one thing I was pretty much interested in, and midwifery. If I was gonna do anything after, but yeah, public health. If you're supposed to go and do public health in Jamaica, I don't know. Jamaican system is just, a little bit technical to kind of reach where you want. And that's understandable. It's just that it makes you well qualified, before, because I know you have to do probably like say 4 or 5 years of nursing experience or something like that. Then you go and do your midwifery, then you go and do psych. Yeah, you have to do a lot of post-basic training and years of experience before you can actually do your master's in your public health nursing, which is not bad. It prepares you well, because I know a lot of persons here in the state, you see persons graduating today from nursing school, and by tomorrow they're enrolled in a nurse practitioner program. So, yeah, I don't really like that. Darren Speak says, yes, it's more technical. Yeah. Yusuf Abdi says, good morning, nurse. Good morning. It's actually 3:42 p.m. here. Where are you, Abdi? Thank you so much for tuning in. Yeah, so it's a little bit more technical in Jamaica than here, getting into the program. So, I love that about it. Okay, Raquel, nice. Congratulations. What are you going to be doing? Your master's in what? So Raquel says, I'm enrolled in the master's program, hoping to start January. Okay. Yosef says, I'm from Somalia. It's 12:43 a.m. Nice to meet you, Jamaican. Okay. Thank you so much for tuning in. Are you in the nursing field or healthcare field, Abdi? Just curious. Yeah. Yeah. So but the thing, sometimes the nurse practitioner program here, what I don't really like about it, I'm a teacher at the university, English teacher. We do have nursing students at the university, mostly females. Okay, nice. Nice. My when I was going to nursing school, my program had I think we only had 3 male nurses. Yes, it was predominantly female, but I think nowadays there are a lot of male entering the program, including Mr. Deron, who went through. Deron, did you go to NCU? For some strange reason, I feel like you went to NC. I never asked you. I don't remember seeing it, hearing you say anything like that in your video. Darren says, are you pretty much done for the day? What does your schedule look like on a daily basis? Looks like plenty driving. You went to UE. Oh, you went to UE, Darren. Okay, cool. So with me, I normally leave out. My day is normally... All right, so it depends. Like today, I saw 9 patients, and I started seeing my first patient around 10:05, and then by 2, it was like 2:15, I was finished. So yeah, so it took me about an hour to drive to the location I wanted to see the patients this morning, and then I started seeing them. Usually my visits probably last 15 to 20 minutes, depending on what's going on. And then, yeah, so my day is not really that busy. Yeah, it's not really that busy. I have a lot of downtime. I get a chance to get up and, do whatever I feel like. Then leave out probably like say 8, 9 o'clock. And then by 10 o'clock I start. I try to target, finishing by 2:30, 3 o'clock, just because I want to beat the traffic to head back home. So yes, I do a lot of driving. Some days I can be out in the field a little bit longer, depending on what's going on with some of the patients and where they're at. Because sometimes, even if I want to do, say for example, one zip code, I might not get a chance to see all of them in that area on that same specific day, and so I may end up driving like probably 15 minutes, 20 minutes to see another 4 patients or so. So yeah. Yosef says, I want to visit Jamaica, God willing I will. Okay, nice. Yes, you will. Hi, Vibing with VC, thank you so much for tuning in. Nice. Nikki says, how long does it take to chart after seeing those patients? So it depends on the system you're using, because you have some systems that are easy to use, so it makes life easier for you, and those EMRs can take me probably like say 15 minutes, 20 minutes to complete the charting, especially if you are familiar with the patient. So the good thing about it is that if you have a set of patients that you're given to see, they try to keep you with those patients, so that way you build a relationship, their history. So when it go in to see them, it's a little bit more straightforward. When you have like an admission where you don't know anything about the patient, or if it's the first time you're seeing the patient, it's gonna be a little bit lengthy. An admission can run you probably like 1 hour. So I don't do admissions as a nurse practitioner. When I was a RN, I would do admissions only because it pays more money in home health. But I don't do admissions as a nurse practitioner because, yes, it's too lengthy, and I can't deal with the charting with some of these computers. So yeah. But after seeing the patients, if it's a patient that is familiar with me, it can take me probably like 15, 20 minutes to complete the chart. But just imagine you see probably like 15 patients today. You have all of those chartings to do, including your plan and everything. And then depending on the office, because remember, you're not working from an actual office, you definitely have to sometimes be, we have like group chats where you send out information that the office need to deal with on behalf of the patients. So you have to think about, doing all of that. So yeah, probably like say 15, 20 minutes after. So there's a lot of work you have to do, because then you have to think about the next day. So by the time you finish, you're probably seeing 15 times 5 patients is roughly what? 45? No. 15 times 5 is what? It's 30, 60. So that's what, 75 patients you'll probably see for the week. So yeah. Dal Queen says, guys, I met her in person last week. She's an amazing nurse. Dal Queen, when did we meet? Oh, I think I remember who this person is. If you are the person I met at this nursing home, just go ahead and just confirm it down below. Thank you so much for tuning in, Dal Queen. I think it's you, though, because you're the only Jamaican I remember meeting last week. So, yes, Alexandria Zaharia says hi. Zaharia, do you know that that's a really nice name? I plan on naming my daughter Zaharia. My son's name is Zarian. And I said, if it's a girl, well, I'm not pregnant, no, people, but I'm just saying, at the time when I was deciding on, the gender, I was like, okay, if it's a boy, it's going to be Zarian. And if it's a girl, I'm going to put a twist to it, and it's going to be Zaharia. And so, yes, it's nice to see that somebody else has that name. Okay, nice. Okay, so Dal Queen says you're welcome. So it is her indeed. Thank you so much, Dal Queen, for popping in. Stick Lover 3 says hi. Hi, Stick Lover. Welcome to the channel. Thank you so much for tuning in. All right. Yeah. So where was I with that? So yes. So regarding the charting, that's the most technical part about the whole visit. It's not necessarily seeing the patients. It's more getting all of those orders in and then trying to reach out to the office. Otherwise, if it was more of just seeing the patients and doing like a few notes, and then depending on the practice that you're working with, they have like a template that they want you to have your notes in. So you have a template that you definitely have to follow, so that can be a little bit tricky as well, because you have some providers who are like to the point, and then you have some that are like complicated. So it depends on what you're looking for then, but for the majority of the time with my company, I love my company. Not the charting aspect of it, because the charting aspect is like headache, but in terms of the flexibility I have and the relationship with the owner, I can talk with her regarding anything, and she basically listens when you do give her suggestions. So I kind of like the openness with her, and it just makes life a little bit easier, so okay. The virtual visits are a little bit easier as well. It's not that technical in comparison to like your in-person visits. So another thing about it is that I like. Remember everyone to go ahead and double tap the screen. Daron reminded me or us to go ahead and do that. Give the video a thumbs up. I remember to go ahead and put any questions you have here, or if you want to talk about something specific, can always reach out as well via Facebook or not Twitter, TikTok and Instagram. Yeah, so that's open as well.